It is a plant that's used as a spice, especially in many foods, but it is also now used to treat pain. We're getting some answers today on how turmeric can help with conditions such as knee problems. With more on this is local North Shore neurologist, Dr. Chad Domingue. Thank you so much for joining us.
Good afternoon. I've done my homework. Excited to share with everyone.
Oh, that is great. It's always great to see where you can use something for various conditions, right? So explain,
Yes.
what exactly is turmeric? How does it work?
Yeah, so turmeric, I've heard it said
I know,
tomatoes
me
many
too.
times. It's very difficult. So turmeric, like you said, it is a plant. It's in a root category. So it's actually the root. It's called a rhizome. Rhizome is the name, and from that root you pull what's called curcumin, and that is the actual component that gives the medical effect. It works like an anti-inflammatory. Basically, what it does is it decreases all these inflammatory mediators, much like ibuprofen, Aleve, and so forth, to reduce the inflammation in joints. What's exciting about turmeric is that it doesn't have the negative effects associated with anti-inflammatories. So it doesn't blow out your kidneys, it doesn't give you ulcers, so it doesn't have these high-level side effects that we see with all these over-the-counter medications.
So talk about the patients that you use it on and the conditions that it can treat.
Yeah, so when I was doing my research, I've seen everything, just like we've talked about with these supplements, all these claim to fames, right? Anti-cancer, Alzheimer's disease, reduction of cholesterol. But where you really see it is for people with arthritis. And just to give your viewers some idea of how bad osteoarthritis is in our world, it's estimated 27 million people suffer with osteoarthritis. I saw in states like Hawaii, it's 13% of the population. States like West Virginia, it's almost 40% of the population. It's based on obesity, diet, smoking, lifestyle, and so forth. So to me, where I see this supplement having its real value is dealing with these patients with osteoarthritis. You mentioned knee arthritis. Because again, when you look at these patient populations, what's the solution? Anti-inflammatories, injections, surgeries, so forth. But these are patients that suffer at a very, very high level and many times don't have anything to turn to.
So when you recommend it, and of course we always stress to talk to your doctor first, how would they use something like this?
Yeah, and this is, to show off all these studies I did a huge analysis. One study did a meta-analysis, which is basically pulling multiple studies. They pulled 10,000 studies and they pulled like the top 10 or 20 that had the best medical evidence. And the frustrating thing as a medical doctor is we don't get a straightforward answer. I've seen evidence from 100 milligrams to 2 grams a day. None of the studies showed this supplement past 8 months, so I can't speak to that. But from a side effect standpoint, it has a very nice profile. Maybe a little bit of nausea, diarrhea, but these are very mild side effects. If you have gallbladder issues, that is something you need to talk to your doctor about because it
Right.
can make gallstones worse. You should not take this if you're pregnant because there's no safety studies looking at turmeric in pregnancy.
So so my last question to you, it deals with fighting inflation, not inflation, here I am talking about economics,
Yeah.
inflammation. So do you take it in a pill form? Do you try to add it in your foods? How would you use it if you feel like you've got some inflammation problems?
Yeah, so that's part of what I did in my research is all over the place. There's liquids, there's pills, there's creams, you name it. It's got a very yellow discoloration. If you ever eat Indian food or Asian food, that gives it that yellow, that color to it. But again, how often, how much, what brand, what dose? The absorption of turmeric is not great, so you have to take a large quantity. But again, I really can't give the viewers here a direct answer as to which formulation or dose to take. My advice is to look at reviews, talk to people that have used it before, the best you can. But unfortunately, we just don't know the answer.
Okay, something to think about and something to ask your doctor about to see how it can work to help you. Thank you so much. Appreciate it.
Absolutely, always a pleasure. Take care, everyone.